So have you ever felt completely stuck, like caught in this crazy bureaucratic maze just trying to get something essential done?
Oh, definitely.
Yeah.
Or maybe you've seen it happen, right? Where, an expert's clear judgment just gets pushed aside by the system.
Exactly. It's maddening, especially when it comes to something as vital as healthcare.
Yeah, it really can be.
Well, welcome everyone to a deep dive into, well, just the really complex, often kind of contentious world of the U.S. healthcare system.
Hmm.
Our mission today really is to unpack these critical tensions,
Yeah.
between actual patient care, the autonomy doctors have or should have,
Right.
the huge influence of insurance companies, and also the potential impact of these proposed government budget cuts we're hearing about.
And we've gone through a whole stack of your sources. We're
Yeah.
talking reports, surveys, recent news articles to pull out the most important bits of information.
Yeah, the nuggets of knowledge, you could say.
Exactly. So we'll explore some recent proposals, maybe expose some surprising motivations humming away inside the system,
Hmm.
and really lay out what's at stake for millions of people and for the wider economy, too.
Get ready for some, maybe some aha moments, hopefully, because we're jumping right in.
Let's do it.
So this first big theme feels like a constant struggle, this tug of war between a doctor's judgment and, well, the insurance company overriding it.
Yeah, it's becoming really common, disturbingly so, for insurers to step in and just say no to what a doctor recommends.
And how do they actually do that? What are the tools they use?
Well, the sources point to a few key things. There are prior authorizations.
Hmm.
You know, the doctor has to get the insurer's okay before they can even order a test or prescribe something,
Ugh, those forms.
right? Or step therapies. That's where you, the patient, might be forced to try a cheaper drug first, even if your doctor thinks something else is much better for you.
Even if it's less effective.
Potentially, yeah. And increasingly, we're seeing AI systems, algorithms playing a big role in making these denial decisions. Often, it seems, optimizing for cost savings over clinical need.
Okay, that's worrying. And you found some data on this?
There's a pretty stark survey from 2018 mentioned in the sources. It found almost 9 out of 10 doctors felt that insurance companies frequently, even routinely, overrode their decisions.
9 out of 10. Wow.
Yeah. And 87% reported direct interference with choosing individualized treatments. It starts to paint a picture of a system where, algorithms sometimes seem to have more say than actual medical training.
So you have doctors with years, decades sometimes, of training making these really nuanced judgments.
Right.
And then these decisions are getting systematically overridden. Is that what groups like the AMA are saying?
Pretty much. The American Medical Association, for instance, warns that these AI-driven denials can, and sometimes do, systematically override what they call good medical judgment.
So if doctors are being sidelined like this, what does that actually mean for patients day to day? Are these tech systems just like accidentally blocking payments, or is it more deliberate?
Well, the sources suggest it leans more towards deliberate design, or at least a known outcome. These tech-powered claims processes, they do halt payments, or they discourage certain types of care.
What leads to?
Leads to delays, administrative hassles, treatment getting pushed back. And while, yeah, maybe it saves the insurance companies some money in the short term,
Mm-hmm.
it often comes at a real cost to you, the patient. A cost in terms of getting timely, effective care. That's the human impact right there.
So connecting the dots, it's this fundamental tension, isn't it? Doctors are driven by patient well-being, ideally.
Mm.
Insurers, fundamentally, are businesses driven by cost management. And that creates these bureaucratic walls between doctors and the care they know their patients need.
Precisely. It puts doctors in a really tough spot.
Okay, let's shift gears a bit. Let's unpack this next really big piece. Medicaid. There's been a lot of noise around recent federal budget proposals. One specific nickname flying around is the One Big Beautiful Bill.
Right. And a major part of that discussion involves potentially huge cuts to Medicaid.
How huge are we talking?
Well, the sources indicate both House and Senate versions were looking at cuts somewhere in the range of, get this, $793 billion to $863 billion
Oh, well,
over 10 years.
billion. With a B. That's enormous.
It's massive. And the estimates suggest if cuts like that went through, It can mean anywhere from 8 to 12 million people losing their health coverage by 2034.
Millions of people. So how would they actually achieve these cuts? It's not just crossing out a number, right? There are specific changes involved.
Exactly. The proposals included things like much stricter work requirements to qualify for Medicaid.
Okay.
Also, more frequent enrollment redeterminations, meaning people have to prove they're eligible more often, which, increases the chance they might lose coverage due to paperwork issues or slight changes in
It's
circumstance.
just more hoops to jump through.
Basically, yes. And also changes to things like provider tax credits. That's a somewhat complex way states help fund their share of Medicaid, but weakening those tools would force states to find the money elsewhere or cut services.
And what about the ripple effects? Beyond the individuals losing coverage, what does that do to the economy?
Well, this is where it gets pretty striking. The Congressional Budget Office, the CBO, they're the nonpartisan folks who analyze economic impacts for Congress.
Right.
Along with the Kaiser Family Foundation, KFF, they modeled these proposed cuts. Their estimates pointed to potential job losses of around 1.22 million by 2029.
Wow, over 1 million jobs.
Yeah, and a hit to state GDP, the overall economic output of states of about $154 billion, plus state and local tax revenues could drop by maybe $9 to $12 billion a year.
So less money for schools, roads, everything else.
Could be. And it also puts safety net hospitals, the ones serving the most vulnerable communities, at a much higher risk of closing down.
And who bears the brunt of these cuts? Is it spread evenly?
Not according to the analyses. The sources are quite clear. These kinds of cuts disproportionately harm already vulnerable groups. We're talking children, seniors, people with disabilities, most of whom just don't have other options for coverage.
Now, politically, were these cuts universally popular within, say, the Republican Party proposing them?
Not entirely, no. It's interesting, the sources mention even moderate Republicans, like Senator Tillis from North Carolina, publicly criticized the scale of these cuts. He apparently flagged a potential $32 billion negative impact just on his state alone, called it reckless.
So some pushback even from within.
Definitely. And there was a pretty significant development on this front, too.
Oh, yeah. What was that?
The Senate parliamentarian, that's the official advisor on Senate rules, actually ruled that several of the big planned cuts, specifically those tied to those Medicaid provider taxes we mentioned, they violated Senate budget rules, meaning they need 60 votes to pass, not just a simple majority.
So that put the brakes on some of the deepest cuts, at least for now.
It certainly stalled those specific proposals.
Yeah.
Made them much harder to pass.
Interesting. Now, you also mentioned alternative viewpoints on dealing with Medicaid dependency.
Right. It's not just about cutting or maintaining. We see figures like Mark Cuban, the business leader, arguing that the root issue isn't necessarily the program itself, but maybe low wages.
His argument being?
That relying on low wages that force people onto Medicaid isn't sustainable. He actually champions higher pay from employers as a better way to reduce dependency, rather than just cutting the safety net.
A different angle entirely. Fascinating. So, okay, if we sort of peel back another layer here, we start seeing these financial motivations within the system, which brings us to this term some sources use, the poverty industrial complex. What does that mean in this context?
Well, it refers to the idea that some large corporations, particularly big insurers and companies that manage Medicaid plans for states like Centene or Maximus were mentioned,
Okay.
that they're actually profiting quite significantly from the system as it exists. This privatization, the argument goes, creates financial incentives for them to keep things complex, to keep care tied up in complicated reimbursement rules.
And potentially to deny claims.
And potentially to maximize claim denials? Yes, because that can directly impact their bottom line.
That feels pretty unsettling. The idea that complexity itself could be profitable. Is there a concrete example of this?
Yeah, the sources mentioned Centene, which is a major player in managing Medicaid contracts for states.
Yeah.
They've apparently faced lawsuits over allegations of denying legitimate coverage or misleading people about it, and even overbilling state Medicaid programs.
Wow.
And the argument is that their profit margins actually increase when policies add more gatekeeping. Things like prior authorizations, strict work rules, making people renew constantly, even rules about recovering costs from estates after someone dies.
All things that add administrative hurdles.
Exactly. More hurdles, more complexity, potentially more profit for those managing the complexity.
Okay, this leads to a really interesting question then. If these big managed care companies are, in some ways, profiting from Medicaid, why aren't they loudly protesting these huge proposed budget cuts? You'd think they'd want more volume, more people on Medicaid, right?
It is a bit of a paradox, isn't it? And the sources suggest the reasons for their relative silence are Well, they're subtle.
Okay, unpack that for us. Why stay quiet?
Well, first, there could be potential short-term gains in their margins. If federal money goes down, states might have to pay more, or patients might face higher out-of-pocket costs. Insurers, who are good at negotiating rebates or managing costs, might actually see profits go up in some scenarios, even with fewer people enrolled overall.
Ah, a different kind of financial calculus. What else?
There's also just the sheer administrative chaos factor. Cutting enrollment sounds simple, but it actually creates a lot of churn. People losing coverage, appealing, reapplying. That increases overhead and bureaucracy.
Which they might resent, but they're also maybe good at navigating.
Perhaps. They might quietly dislike the chaos, but not want to draw attention to it publicly. Then there's the regulatory risk.
Meaning?
If there's huge public backlash over millions losing coverage, that could lead to calls for much stricter rules on things they rely on, like prior authorization or those AI denial systems.
Ah, so tighter regulations are something they definitely want to avoid.
Exactly. So keeping a low profile during a potentially unpopular cutting process helps them dodge that kind of scrutiny.
And I suppose there's just the basic PR aspect, too, political cover.
Absolutely. No company wants to be publicly associated with wildly unpopular policies like massive Medicaid cuts. It's terrible for their image.
Right.
So while some parts of the industry might find ways to profit even amidst cuts, the overall disruption isn't necessarily good for everyone in the sector, but their public silence. It speaks volumes, doesn't it?
It really does. Okay, so after digging into all of this, the doctor versus insurer battle, the Medicaid cuts, the profit motives, what does this mean for us? What kind of path forward do the sources suggest? What are the key recommendations for reform?
Well, pulling it all together, a big one is about restoring or maybe recentering the doctor's authority.
How?
Things like seriously limiting prior authorizations, maybe only for really experimental treatments, not routine care, and streamlining policies so you don't have these blanket denials happening so often.
Okay, empowering doctors more. What else?
Then there's tackling that for-profit gatekeeping we talked about. The sources push for much more transparency around how insurers make decisions, especially with algorithms.
Letting us see inside the black box a bit.
Exactly. And encouraging states to really audit these managed care companies and actually penalize them if they're denying care that goes against accepted medical standards.
Holding them accountable makes sense.
And fundamentally, preserving Medicaid itself. Treating it not just as a cost, but as essential social infrastructure.
Right. You mentioned the economic impacts earlier.
Yeah, the evidence suggests the long-term economic and social costs of people losing coverage, job losses, hospital closures, families facing ruin far outweigh any short-term federal budget savings. Medicaid supports jobs, keeps hospitals open, and protects families.
It's an investment, not just an expense.
That's the argument. And connected to that, there's the idea we touched on earlier from people like Mark Cuban, focus on increasing wages.
So people need Medicaid less.
Right. Instead of making eligibility harder through punitive rules, maybe the focus should be on employers paying wages that allow people to afford their own insurance or need less assistance. A structural solution.
Interesting. And one last thing.
Regulatory vigilance, especially now with AI playing a bigger role. Use this moment, the sources argue, to put real guardrails in place.
Like what kind of guardrails?
Things like requiring human review of AI denials, keeping clear audit logs of how decisions are made, and having real penalties for wrongful denials caused by algorithms.
Makes sense. Wow. We've really pulled back the curtain quite a bit here today.
Think so?
We've looked at how insurance practices impact doctors and patients, the huge potential fallout from Medicaid cuts, those surprising financial gears grinding away inside the system, and importantly, some potential paths toward making things better.
And it really underscores that healthcare isn't just, a line item on a budget spreadsheet. It's fundamentally about human dignity. It's about the integrity of a doctor's judgment. It's about the health of our communities.
Yeah. Doctors, they train to heal people, right? Not to spend hours battling bureaucracies. And Medicaid, it's clearly a lifeline for so many.
Absolutely.
So the final question for you, listening, what does all this mean for you? How can we collectively push for a system where those profit-driven roadblocks are taken down, where clinical judgment is respected, and where healthcare genuinely focuses on human well-being?
That's definitely something to think about.
Something for you to mull over and maybe dig into a bit more on your own.